Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
What would you do if a sudden stabbing pelvic pain revealed a hidden ovarian cyst, one that might fade quietly or send you straight to surgery? Welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and with me is my co-host, Alara Sky. Today we're taking a deep, practical look at ovarian cysts, why they form, when they become dangerous, and what you can do right now to protect your reproductive health.
Most ovarian cysts are called functional cysts. They're part of ovulation, and 2/3 dissolve on their own within a few cycles. You might never feel them. The trouble starts when a cyst grows, ruptures, or twists the ovary in torsion, cutting off blood flow and threatening fertility if it isn't treated immediately.
Let's ground this in symptoms. If you feel sharp lower abdominal pain, nausea, or vomiting that escalates quickly, that could signal torsion or rupture. Intense bloating, pain during sex, or sudden changes in urination are other clues. Seek urgent imaging because timing matters.
Imaging means a transvaginal ultrasound. It shows size, shape, fluid content, and blood flow. A simple, fluid-only cyst under 5 centimeters often just gets monitored. But a complex cyst, one with solid areas or finger-like projections, triggers extra labs, usually a CA-125 blood test, to rule out malignancy.
Many listeners over 50 worry any cyst is cancer. One study followed postmenopausal women with stable cysts for 3.5 years. Their risk of ovarian cancer was only 0.27%. Careful monitoring can spare unnecessary surgery even after menopause.
Still, not all cysts follow the functional pattern. Dermoid cysts come from embryonic cells, endometriomas link to endometriosis, and cystadenomas form from ovarian tissue. They can press on your bladder or bowel, causing pelvic pressure or back pain. When any cyst exceeds 10 centimeters, about 4 inches, surgeons often intervene to relieve pressure and prevent complications.
Let's shift to lifestyle factors. The article highlights vegetable oils, canola, sunflower, corn, soybean, and grapeseed, as silent saboteurs. In a 4-week animal study, rats fed these oils showed ovarian atrophy and multiple follicular cysts. Serum estradiol spiked, acting like a false estrogen signal.
That false signal comes from linoleic acid, a polyunsaturated fat that behaves like a xenoestrogen. It overstimulates estrogen receptors, derailing normal hormone feedback loops. The takeaway is simple. Eliminate seed oils and replace them with stable saturated fats like grass-fed butter, ghee, or tallow.
Seed oils aren't the only driver. Polycystic ovary syndrome, or PCOS, is another major culprit. PCOS combines insulin resistance, elevated androgens, and irregular cycles. Those factors interrupt ovulation and leave multiple small cysts studding the ovaries.
If you suspect PCOS, ask your practitioner for a HOMA-IR test. It looks at fasting insulin and glucose together. A score above 1 suggests insulin resistance, even when blood sugar seems normal. Correcting insulin resistance through regular movement, walking, stretching, resistance training, and cleaning up diet is foundational.
Motion is medicine. A systematic review found exercise combined with dietary change improved PCOS symptoms more than diet alone. Even a brisk 20-minute walk after meals blunts insulin spikes and supports hormonal harmony.
While you're making those changes, you still need symptom relief. Heat therapy, a warm compress across the lower abdomen, relaxes tight muscles and increases blood flow. Gentle self-massage of the lower back and thighs reduces tension. Alternate heat and ice if swelling is pronounced.
Herbal support helps too. Chamomile tea eases menstrual cramping and lowers testosterone levels, which are often high in PCOS. Ginger tea reduces inflammation and supports balanced reproductive hormones. These teas won't shrink a cyst, but they can make daily comfort manageable.
Stress magnifies pain signals. Practices like slow diaphragmatic breathing, guided meditation, or restorative yoga calm your nervous system. They also lower cortisol, which indirectly supports healthy hormone cycling.
Speaking of hormones, natural progesterone deserves attention. A 2020 study showed cyclic progesterone therapy lowered androgens and restored estradiol to progesterone balance in PCOS. Used under professional guidance, natural progesterone supports timely ovulation and can reduce new cyst formation without synthetic hormone side effects.
Let's recap concrete actions. First, clear seed oils from your kitchen. Check labels on dressings, chips, nut butters, and restaurant foods. Second, move daily, at least 30 minutes of combined walking and light strength work. Third, if you have PCOS or recurrent cysts, test insulin with HOMA-IR and discuss natural progesterone with your provider.
Fourth, build pain management rituals, heat, massage, gentle yoga, and calming teas. Fifth, track your symptoms, cycle length, pain patterns, and digestive changes. That log gives your clinician context and helps decide whether imaging is necessary.
Remember, not every cyst spells disaster. 2/3 resolve on their own, and even complex cysts are rarely cancerous. Early awareness, smart diagnostics, and lifestyle corrections keep most situations from escalating.
Seed oils are only one piece of the endocrine puzzle. Everyday items like plastic wraps, scented lotions, and many cleaning products contain phthalates and parabens that mimic estrogen. Replacing plastic storage with glass and choosing unscented, phthalate-free personal care items reduces that invisible hormonal noise.
Start small. Swap plastic water bottles for stainless steel, store leftovers in glass, and read ingredient lists for words like fragrance or parfum, common code for endocrine disruptors. These tweaks lower cumulative exposure, giving your ovaries and the rest of your endocrine system room to recalibrate.
Sunlight matters too. Vitamin D deficiency is common in women with PCOS. Aim for brief morning sun before 10 a.m. or late afternoon exposure after 4 p.m. until you've lowered dietary linoleic acid for at least 6 months. That timing balances vitamin D synthesis with minimal oxidative stress.
Finally, remember that healthcare is a partnership. Bring your symptom log, dietary changes, and lab results to each appointment. Clear communication helps your practitioner tailor follow-up imaging or hormone testing and keeps you at the center of every decision about your reproductive future.
All right, listeners, it's action time. Over the next 7 days, purge every bottle of canola, sunflower, corn, soybean, and grapeseed oil from your pantry. Replace them with butter, ghee, or tallow, and log a 10-minute walk after one meal each day. Track your energy, digestion, and cycle cues. Small steps compound into big hormonal wins.
You have the knowledge and the tools. Use them to steer your body toward balance, one decision at a time. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.